Good morning, good evening. Welcome to our guest, Dr. Mentor Ahmeti, my co-host, Dr. Abhiraj Yadav, and all the attendees. Today, we have the pleasure of discussing with Dr. Ahmeti Mentor. He's a colleague and a dear friend of mine who graciously agreed to come on this platform to share his knowledge and suggestions for students aspiring to get into surgical residency program in the United States. It is my pleasure to introduce Dr. Ahmeti Mentor. Dr. Ahmeti Mentor carries a lot of qualifications and professional holdings, so I'm going to have to read them out properly. Dr. Ahmeti hails from Kosovo, former Yugoslavia. He finished his medical school at University of Pristina and University of Tirana. He further went into doing internship in surgery in Kosovo, after which he moved to USA for specialty training. He completed his preliminary internship, followed by categorical residency training in general surgery at Texas Tech University. He further completed a fellowship in surgical critical care at University of Texas, San Antonio. He is currently the Chief of Trauma Service Line at Sanford Medical Center, Fargo, North Dakota. He also holds various academic titles, which include Vice Chair of Education and Research and Head of Traditional Track Surgical Residency Program at University of North Dakota Medical School and Health Sciences. Dr. Ahmeti is also the President-elect of North Dakota chapter of American College of Surgeons, Vice President for USA Kosovo College of Surgeons. He's the Chairman of ATLS Kosovo Promulgation Program. Thank you very much, Dr. Mentor, for joining us. It's an honor to have you on this platform with us.
Thank you, Dr. Monroe. It's truly a pleasure. I really appreciate the privilege and, your opinion of me to bring me here and try to share my experiences and kind of what I know about the application process for the residency.
Thank you. Thank you. I would like to now introduce my co-host, Dr. Abhiraj Yadav. He is an intern currently in Manipal Medical School, Nepal. He's an NRMP applicant for 2026 year. He's going through his intern training and will be actively trying to get into residency next year. He carries a lot of passion in supporting students who are aspiring to come into the US. He tutors them. He also has a company called Stenosis Report that assists with research and scholarly activities for medical students. I had the pleasure of knowing Dr. Abhiraj for the last few months when he reached out to me to pursue a interview, and then we've been supporting each other to help the students across different countries.
Thank you, Dr. Monroe. Thank you so much for having me here. It is a really special opportunity for me to be here with you all. And thank you to all the participants and Dr. Mentor for helping us all. Thank you.
So what I'm going to do is, without any further delay, we'll do some housekeeping rules. So I would request all the attendees to focus on what Dr. Mentor has to say. It is not easy to obtain a surgical program director to come up and have a discussion like this. We're fortunate enough to have Dr. Mentor, so please use this time to listen and understand everything he has to say. Secondly, we will give you time for a few minutes to put all the questions in the chat box. The first session I will host. I will ask all the questions that we have put together, which we strongly believe will help you. And then the second half, we'll request Dr. Abhiraj to review the chat box and also ask the questions that were sent to us ahead of this session. We're going to start with our first questions. Dr. Mentor, surgical specialty is a very tough specialty. If we look at the statistics, there's only about 4 or 5% students from international medical graduates that match. However, my first question for you is, could you briefly talk about surgical specialty as a residency? How long it takes, what's the perspective and stuff like that. And then I have a follow-up question to that.
I hope this alarm will not really make me not be heard very well. So, yep, it is pretty hard to get into general surgery. It tends to be very competitive. I think the numbers that you said are very accurate, but at the same time, we have to realize that there's only 1,600 surgery spots, and that tends to be 10,000 applicants, out of which majority are US grads. So even all US grads do not get into surgery that they need to. There are some circuitous ways to get into general surgery. But again, it is quite competitive. As far as general surgery by itself, in the United States, it's a 5-year training program. There are a few larger programs that require years of research, and that might prolong the process a little bit longer. Our program does not require research. I would say most programs do offer the ability to go through straight to 5 years. As for medical graduates, it's very few that immediately enter directly into residency as a categorical position to move forward. Are you guys hearing me well? I'm sorry, this is okay. It's very distracting to me. The most of the IMG candidates that I'm aware of that sort of start residency as categoricals, which are honestly very few or maybe a couple a year, tend to be candidates that have participated in fellowships, either clinical fellowships or research fellowships, that are very, very high end. Those are extremely exclusive, and they tend to be very productive during those fellowships. What I mean by that is they tend to publish in very big journals. There's a group down in Arizona that has an international research fellowship, and they tend to publish a lot of papers in Journal of Trauma and Acute Care Surgery, which is an extremely difficult journal to publish in. And when their candidates come through, they have between 6 and 12 publications by the time they're applying in that. And that really carries a lot of weight. And those are the only ones that I see that actually match directly into surgery as categoricals. The circuitous route, which is the one I took, was matching into a prelim spot. So I matched in a prelim position when I came here, and worked extremely hard during that 1 year. And the best opportunity is to match as a prelim resident in a place that has a history of keeping the prelim residents. Okay. It is very challenging, I think, and almost cruel when sometimes we see that somebody who's passionate about surgery has done a year of prelim position, and then they are unable to stay in a categorical position. I think that carries a few issues, the main one of which is the J1 visa. As you may know, for candidates who are not green card holders or citizens of the United States, the great majority of surgical programs only offer J1 visas. It's near impossible, and I'm not aware of any that offer H-1B visas. What a J1 visa is, for the ones who do not know, it's actually a contract between you and your government, your native government, that you will return to your country for 2 years after you finish your training. And finishing a preliminary year is considered finishing your training. So if you don't have a position to fall back into after your prelim year, you have to go back. And that is the big challenge. So in those situations, for candidates that do match into a prelim position, it is very important to be the best resident during that year, because the best chance of you staying and training in the States in surgery would be to be kept at the program where you're doing your prelim year. And it's honestly heartbreaking when you have one or two or three very good IMG candidates. And, most programs tend to keep one or two and have to let one go. And that tends to be very, very challenging because that leaves very little room. Nobody knows until mid-March if they've matched or not. And then following that, it leaves you a very short period of time to place that resident somewhere. And as you know, residency in the United States is becoming very, very competitive across all fields. So it's very challenging to find a spot for those residents. I'm not sure if that kind of give you a too big of a picture or you want me to focus on something more.
No, I think you've covered it very well. Thank you. In summary, what I understood is it's a challenging specialty, and it's even more challenging for IMGs. And there are two ways you could get in. One is you have extensive publications and try to get into a categorical straight. And then the other alternative option is to start with the preliminary position, do your best in that 1 year, and then try to get into the program. And unfortunately, IMGs are faced with the visa issue, and most of surgical programs do offer only J1s at this time. No, thank you. That was very helpful.
I think one thing that I failed to mention, which is very important, and it's something that we put a lot of weight to during our residency application process, is hands-on clinical experience in the United States. I think that is a very, very important. There are programs where they do have the capacity to maybe provide you with some boot camp training prior to starting your clinical work. I know, Dev, that some of your programs for the first 6 weeks, I think, internal medicine and family medicine, do a boot camp where they teach the residents how to be residents. In surgery, the work is so intense, and we have such a large volume of work with a small number of residents that, you get thrown into the deep end of the pool on July 1st or 2nd when you get started. So there is an anticipation for the new interns to actually do have some level of competence to start working the moment the residency starts.
Thank you. Moving on to the next question. Could you elaborate on USM scores and the weightage that is put on the scores in selecting candidates for interviews, and also the weightage that these scores carry in ranking students at this time?
They probably carry the most weight. The door does not open if you don't have a high score. That's the foot through the door, the colloquial foot through the door in America. If there's not a good score for an FMG, the likelihood of entering, being invited for an interview is very low. When it comes to then doing the rank list, that also carries a significant amount of weight. But at that point, it's a very holistic and complex review and decision-making to see who is going to be ranked. And in that, we take into account a significant number of things. I find that among foreign medical graduates, there's two large groups. There are people that want to come here to get the best surgical training in the world. And there are people who want to come here and live in America and be a physician in America. To me, those are two very different groups. Both have just as much stake in becoming physicians here, and I respect both. But especially on the surgery part of thing, we tend to focus on candidates who are passionate about surgery. Okay? If there is anything during the process that might lead us to believe that the application process is being used to become a surgeon with the only reason of immigrating and living in America, that will deduct some points. Okay. We want to train surgeons. And if in the process they become Americans, that's great. Does that make sense? But ultimately, we want to train surgeons. So I think that is one very important stuff. And we do find out that, the ones that really want to become surgeons, they have alternatives to become surgeons somewhere else if their process in America does not move forward. And then the ones that want to become physicians in America, and Americans use that as a vehicle to immigrate here, which is very justifiable, in my opinion. They have alternatives, but their alternatives are in the United States in the form of different specialties.
Got it. Thank you. Now, a follow-up question to this is that do you have a ballpark on what's the average score that usually programs look at or think about before entertaining students? I mean, it's not any specific question to like one program, but just in general, what you've seen.
Yes. But the scores are becoming stratospheric now. When I applied 20 years ago, if you heard that somebody had a score of 260, 270, or even 280, that was just, you never heard that. And now that's becoming a little bit more frequent, which is very, very interesting. So as you know, all the programs are very heterogeneous across the United States. So everyone puts slightly different weight on different things. I would say most programs have filters set at about 220, average of 220, maybe 230, where when you go through the match process through ARAS, anybody below those scores will get filtered out. Okay. So in our program, we match 5 categorical residents and we match 3 preliminary residents. But we get near 500 applications for those spots. Okay. So we're talking about 1 in 10 for categorical positions. And we cannot interview 500 people. Okay. So that's why the program just sets a limit and then we only see a certain number. So we might see 300, 350 applications. And then those 350 applications, we will go through them page by page, everything, what they did in their life, their CV, where they're from, what their scores are, what they've achieved during medical school, what they've achieved in their clinicals, their MSPE, personal statement, mission fit to, for instance, North Dakota. And then we decide amongst those the 80 that we are going to bring into interview. Okay. So we try to kind of bring it down from 100 to 1 down to about 10 to 1 per spot. Okay. And it tends to be a very emotionally draining process because you have these superb clinicians, physicians from around the world that are applying, and you're going to only keep 1 in 10. Sometimes you wish I can keep all of them, but that's just impossible.
And I agree, and I concur with you. When we have to review applications, it's not easy. One application, if we thoroughly have to review, that takes no less than 30 minutes. So imagine 30 minutes times 300. That's close to 150 hours of somebody's time and somebody's effective time. So, they really have to be in that moment, the whole 150 hours. Otherwise, they'll miss points. So that's a lot on programs side of things too. Moving on, thank you for that answer. U.S. clinical experience. We have about 11 questions to cover, so I'm going to move fast and then leverage Dr. Mentor's knowledge on answering some other questions that students have put in the chat box. So U.S. clinical experience, what type of U.S. clinical experience will strengthen applicants' opportunity in getting into a program, surgical program?
This is a very short answer. Hands-on clinical experience. Observerships do carry weight, but definitely if I have a recommendation letter by a U.S. surgeon that says that the resident or the applicant participated hands-on on hands-on clinical work and operative experience, that carries a very different sort of weight.
Thank you. And are there programs in the U.S. that do offer hands-on clinical training? I don't know. That's why I was trying to ask.
We do, but we do during medical school. Okay. So if an observership is done after graduating medical school, that will be an observership, sort of shadowing of the physicians. But if you come as a medical student during medical school, then there's hands-on opportunities to do that.
Got it. Thank you. Prelim positions and value in securing a traditional or categorical position. And also, could you elaborate on other benefits of doing a prelim position? You already mentioned about the first part of the story in your question that you answered earlier. Could you elaborate on what are the other benefits of doing a prelim position in your experience?
As you know, Dev, healthcare in every country is done quite differently. I mean, it's done from hospital to hospital, you know. If we go 80 miles up to the sister city up north, they do things a little bit differently, let alone if you did your medical school in Yugoslavia, if you did your medical school in Nepal or India or somewhere else. So I do think that that prelim year really hones down US clinical skills, okay? And that really puts on par a foreign and international medical graduate with a US applicant who has spent the last 2.5 years doing hands-on clinical and being, for a lack of a better word, and it might be like accurate word, for being indoctrinated into the US medical system, okay? Things are very different. For me, that was a big step. I was trained in a different country. I did my internship in a other country, and then I came here, and things were very different. And I do think that that prelim year really helped me become a successful categorical resident.
That helps a lot. You know, learning about US practices and healthcare system is not easy. Going through a few rotations does help, but having a full year of prelim, like you said, is extremely beneficial.
Yes.
In
And
every
I think
possible way.
didn't mean to interrupt you, but I think it goes beyond just hospital systems. There are cultural differences, the way you interact with a patient, the way you interact with your colleagues, the way you interact with your male or female colleagues. You know, in different places around the world, in different cultures, there could be some differences compared to United States. So what I find most helpful is actually that professional cultural aspect of it, rather than necessarily inputting an order or showing empathy in a way that is accepted by a US patient and their family, which might be very different than how it is in Kosovo or in Albania or somewhere else.
I agree. Aviraj, do you have anything to add or ask?
No, sir, everything is going well. We are all enjoying the conversation. Please carry on.
All right, thank you. So my next follow-up question is, does prior surgical training help students in being able to get into surgical residency in the US?
Again, I think that is a very sort of individual question. For me, it does not necessarily carry a lot of weight. It is a positive. It is not a detractor. There are places that value that more, and some bigger programs do want to bring other opinions, other ways of doing things. Our program, as you know, is very, while it's an academic sort of university program, it's very community focused. So our goal is to have residents provide excellent care to the citizens of North Dakota. So at our program, we don't necessarily put a lot of weight in it. I think it's very important for applicants that are here that do have maybe even residencies finished and are surgeons and are going back, is to sort of clean the slate when they start their their residency. I do think that we used to do it this way where I come from, might be a little off-putting. So just keeping that in mind and being cognizant of that, I think is very important. If one thinks they have the ability to start from beginning again, I think that would be great.
No, absolutely. I agree. Thank you. My next question is guidance on research. What type of research should a candidate pursue? And if they are involved in a non-surgical research endeavor, would that have any value in surgery?
I do think it will have value. It just shows that the candidate is exceptionally motivated and they have done research. I do think that it needs to come across that if your research is in dermatology or endocrinology, I think it really needs to come through the application, the message that that was done because there was no opportunities to do surgical research. Okay, I completely understand that. Now, if you have published in the Journal of American College of Surgery, or if you have published in American Surgical Archives or Journal of Trauma and Acute Care Surgery, those are very different. So that's very high level. So they all carry weight, but the weight between them tends to be a little bit different. So if there's a guideline named after you or after your principal investigator or mentor that you participated in surgery, that is very different than a case report on dermatology. But the case report in dermatology does show motivation. So that's better than nothing, if that makes sense. So I think it's a stepwise approach and they carry different weights, but it's a qualitative matter. It's either you have it or you don't. And if you have it, it's much better.
Yeah, this is very helpful. Now, a follow-up question to that, does does the program also value if somebody's put in efforts to enhance their skills in research additionally? Because, we see a lot of candidates churning out articles, case reports, this and that, and then it's hard to differentiate if they really have the skill or they've just kind of anchored or just caught somebody else's leg and then, moved along. What do you think about that?
Yes, I think it carries a lot of weight, and you can see those from the application. As you know, Dev, after 10, 15 years of looking at applications, you become really good at picking up some things. You know, you become really good of hearing those nuances, seeing context in the application. Personal statement does not match with the CV very well. Those are all red flags that we kind of see that are near. So um, having skills to do research, of course, is a tremendous asset. The way I look at residents is, does this person have the capacity to become a surgeon, and have they um, performed in their career up to this point well enough to become a surgeon? That's my number one. My number two, is this a surgeon that I'm going to train is going to go and do general surgery? So somebody I'm going to only invest time in. And then there is a small subset that we see that I say, wow, look at Dinakar's application. He's going to be an asset to our program, you know? And I think those are the most important ones. So when I see that, there's this big research project that was done, and the personal statement says that, I did all the statistics or something of the sort, that is very, very important. Or if I see that in a recommendation letter where the recommending physician says, this candidate, we have done all these projects and they were the ones who did all the work. Because we all know there's always 7, 8 names, but there's 2 people who are doing the work on every publication. So, if your application says that you are one of those 2 people who did the work, that carries a lot of weight, because I know that that person will be an asset to our program, just like we will be an asset to their career.
I agree. Absolutely.